So as we have, so today I am just covering the topic unhealthy gut and the life. So far we have we have discussed about the liver disease, and we have discussed about the which body part of the digestive system take the place of different macronutrient digestion and the absorption. So now I am speaking a little bit about the diseases related to the digestion and the absorption, and later on I will tell you how the lifestyle modification can help you out, and what are the things we need to take care of. So gastrointestinal disease affect our GI tract from mouth to anus in different body part of the this digestive system. So many small things are there, and they create a little bit problems later on, converted into the diseases. So there are two types of problems, like functional and the structural. Functional gastrointestinal disease, they are also known as disorders of gut brain interaction, because as you have heard earlier also, like whatever we think, and whatever we are eating is not exactly giving us the nutrients if our mindset is not proper. So gut brain interaction is really very much important. And functional diseases are those in which the GI tract looks normal when examined but doesn't move properly. So they are the most common problems affecting the GI tract, including colon and rectum. Constipation, irritable bowel syndrome, nausea, gas, bloating, and diarrhea are common examples from those. And the structural gastrointestinal diseases are uh, those where our bowel looks abnormal upon examination and also doesn't work properly. Sometimes the structural abnormality needs to be removed surgically, and common examples of structural GI diseases include strictures, stenosis, hemorrhoids, diverticular disease, colon polyps, colon cancer, and inflammatory bowel diseases. So, what are the causes of this? Eating a diet low in fiber, not getting enough exercises, traveling or other changes in routine, eating large amount of dairy products, stress, resisting the urge to have a bowel movement, possibly because of hemorrhoids, overusing antidiarrheal medications that over time weaken the bowel muscle movements called motility, taking antacids medicines containing calcium or aluminium, taking certain medicines, especially antidepressants, iron pills, and strong pain medicines such as narcotics. Pregnancy, some people also have heightened sensitivity in the organs of their GI tract. Visceral hypersensitivity, this is called, and this can make them feel pain or discomfort even when the organs are functioning normally. So these are the many more known reasons to cause the GI disturbances. Even some of us, we might not be knowing these reasons can add on your digestive issues. So first, like what is the constipation, which is a functional problem? It is a condition in which a person has uncomfortable or infrequent bowel movements. Many times patients come to us and they say, no, we are not having constipation. But when we ask to them, they say like we are having 2 times or 3 times in the morning itself. Means you are having the constipation. In generally, a person is considered to be constipated when bowel movements result in passage of a small amount of hard dry stool, usually fewer than 3 times a week. It is often related to inadequate roughage or fiber in diet or a disruption of regular routine for our diet. So irritable, second is the irritable bowel syndrome, that is IBS, very much common nowadays. It is also called as spastic colon, irritable colon, or IBS, or nervous stomach. Is a functional condition where intestinal muscles contract more or less often than normal. It is characterized by a group of symptoms that commonly include abdominal pain, abdominal bloating, excess gas, and changes in the consistency of bowel movements. Certain foods, medicines, and emotional stress are some factors that can also trigger IBS. So, functional uh, diarrhea, that is chronic diarrhea without any clear cause, it is functional gastrointestinal disorder, meaning that it occurs without any other known signs of disease. injury, or structural problem. The experience of loose or watery stools, lack of pain with the diarrhea. There might be mucus in the stools, but not the blood. Diarrhea occurring at least 75% of bowel movements. Hemorrhoids are dilated veins in anal canal. This is a structural gastrointestinal disease. They are caused by chronic excess pressure from straining during a bowel movement, persistent diarrhea or pregnancy. There are two types of hemorrhoids, internal and external. Internal hemorrhoids are blood vessels on the inside of anal opening. When they fall down into the anus as a result of straining, they become irritated and start to bleed. Ultimately, internal hemorrhoids can fall down enough to prolapse, sink, or stick out of the anus. External hemorrhoids are veins that lie just under the skin on the outside of the anus. Sometimes, after straining, the external hemorrhoidal veins burst and a blood clots form under the skin. This very painful condition is called a pile. Treatment includes removing the clot and the vein under local anesthesia and or removal of that pile. As you can see in this picture also, here like clotting was there and external hemorrhoids become outside the anus. Just a very small prolapse internal hemorrhoids you can see, and the external hemorrhoid also you can see here in the picture. Next is the anal fissures and the anal fistula, very common nowadays because of the constipation. Anal fissures are splits or cracks in the lining of anus, and the most common cause of anal fissure is the passage of very hard or watery stools. The crack in the anal lining exposes the underlying muscles that control the passage of a stool through the anus and out of the body. This leads to intense burning, pain, bleeding, or spasms after bowel movements. Anal fistula is an abnormal tube-like passageway from the anal canal to a hole in the skin near the opening of anus. Body wastes traveling through anal canal are diverted through this tiny canal channel and out through the skin, causing itching and irritation. Fistulas also cause drainage, pain, and bleeding. So then we come to the another type, diverticular disease. That is the presence of small outpouchings in the muscular wall of large intestine that form in weakened areas of the bowel. They usually occur in the sigmoid colon and the high pressure areas of the lower large intestine. It is also a structural gastrointestinal disease. It causes too little roughage in the uh, pipe diet. Complications of diverticular disease including infection and inflammation of the pouches, which can lead to bleeding or obstruction. Colon polyp is a small clumps of cells that forms in the lining of the colon. Most colon polyps are harmless, but over time, some colon polyps can develop into colon cancer. Most early forms of colorectal cancer do not cause symptoms, which makes screening especially important. When symptoms do occur, the cancer might already be quite advanced. Symptoms include blood or mixed in with the stool, a change in normal bowel habits, narrowing the stool, and abdominal pain, weight loss, or constant tiredness. Inflammatory bowel syndrome disease, that is IBD, is characterized by repetitive episodes of inflammation of the gastrointestinal tract caused by an abdominal immune response to gut microflora. It is divided into Crohn's disease and ulcerative colitis. It occurs in genetically susceptible individuals after an exaggerated immune response to a normal stimulus such as food and intestinal flora. Sign of bad gut health. So now we are we have discussed about some of the uh, diseases. Now we come to the how you can check like your gut is not healthy. So the few signs are here, like poor appetite, difficulty in swallowing, stomach pain, nausea, bloating, cramps, constipation, vomiting and diarrhea, blood in the stool, and weight loss or poor uh, growth, and the nutritional deficiency. Many times we have seen like deficiency is there, but you never think of like this is the sign of bad uh, gut of ours. So how we can improve our gut? Many types of things are there. Like first of the very important thing is, if your gut is not healthy, means you are somewhere indirectly or indirectly in stress. So lower our stress level is the first thing. So step one is relax and take time when eating to help digestion. आप बाकी पूरे दिन कितने भी बिजी रहें, कितना भी स्ट्रेस में रहें, लेकिन जब आप खाना खाने बैठ रहे हैं तो आपका सारे स्ट्रेस दूर होना चाहिए. और इवन व्हेन यू आर preparing a food or anyone at your home is preparing a food, he or she should not be in the mental stress. Because जैसे कहा जाता है ना, जैसा हमारा मन होता है वैसा हमारा अन्न हमारे शरीर को लगता है. तो आप अगर सही मन से खाना नहीं बना रहे तो आपके जो वाइब्स है वो उस फूड के साथ आपके गट के अंदर एंटर कर जाते हैं. सो हमें हमेशा फूड से रिलेटेड कोई भी काम करते टाइम पे अपने मन को शांत रखना है. गेट इनफ स्लीप. सोना बहुत बहुत ज्यादा जरूरी है. अगर आप टाइम से नहीं सोते हैं तो आपकी सर्केडियन रिदम अगर अच्छी नहीं है तो आपकी गट हेल्दी नहीं हो सकती, बिकॉज उसे रेस्टिंग टाइम नहीं मिल रहा है. ठीक है. तीसरा है ईट स्लोली. जब भी आप खा रहे हैं, जो कुछ भी आप खा रहे हैं, उसको समझिए. माइंड व्हाट एंड हाउ यू ईट. आराम आराम से चबा चबा कर इंजॉय करके खाइए. गॉड हैज गिवन अस 28 to 32 tooth. Why? The reason behind that is to chew the food properly, cut the food properly, and utilize your tooth properly. Right? Then stay hydrated. It is very, very, very much important that you should drink plenty of water. Take prebiotic or probiotics. Top up your food with that. It will help your gut to have a very good quality of bacteria supporting the digestion and absorption of your food. Change your lifestyle. That is very, very important. Another factor, you can do the exercises, you can do the meditation, you can do any workout, whatever you like, but you should change your lifestyle. As Dr. Kudal also said, like diet should be proper to make you healthy, along with some physical activity should be there in your life. Check for food intolerance as well, and avoidance of food that leads to food allergy. So lower your stress level. How you can reduce your stress? The brain has a direct effect on the stomach and intestines. For example, the very thought of eating can release the stomach's juices before food gets there. ऐसा सुना है ना हम लोगों ने भी घर में कि कभी हम लोग का बहुत अच्छा सा खाना बन रहा है, खुशबू आ रही है तो ऑटोमेटिक मुंह में पानी आने लग जाता है. या कभी हम बहुत अच्छी अच्छी बातें कर रहे हैं, अपना बहुत प्यारा मनपसंद फूड की बात कर रहे हैं तो हमारे मुंह में फिर से पानी आने लग जाता है. होता है ऐसा या नहीं होता है? आप लोगों के साथ भी होता है ना? So this connection goes both ways. A troubled intestine can send signal to the brain, just as a troubled brain can send signals to the gut also. So the nervous system regulates digestive processes like swallowing, release of enzymes to break down food, and the categorization of food as nutrients or waste product. So stress, how to release your stress, that is also again important. Like stress releasing the hormone cortisol, which causing our esophagus to go into spasms. Okay, so increasing the acid in our stomach, which release in indigestion. तो अगर हम स्ट्रेस में होंगे तो क्या क्या हो सकता है? हमारी इसोफेगस के अंदर स्पाज्म होगा, तो आपका प्रॉपर तरीके से आप स्वेलो नहीं कर पाओगे फूड. आपकी स्टमक में प्रॉपर तरीके से एसिड रिलीज नहीं, एसिड ज्यादा रिलीज हो जाएगा, प्रॉपर नहीं रिलीज होगा तो इंडाइजेशन हो जाएगा. फील नॉसियस. कभी आपको लगता है ना एक बार आप खाना खा रहे हो तो आपको वॉमिटिंग जैसे सेंसेशन होता है. समटाइम्स इट मे गिव यू डायरिया, समटाइम्स इट मे गिव यू कॉन्स्टिपेशन. So in more serious cases, stress may cause a decrease in blood flow and oxygen to the stomach as well, which could lead to cramping, inflammation or an imbalance of gut bacteria. तो अभी आप लोगों को क्लियर हो गया होगा. कुछ लोग पूछ रहे थे कि गैस खाना खाने के बाद भी ब्लोटिंग होती है, प्रॉब्लम्स होती है, तो इसका मतलब आपका माइंड सेट उस समय स्ट्रेसफुल रहता है. Ways to manage stress: get regular exercises, consider psychotherapy, yoga, and meditation, develop time management skills. So, along with my team, we do all the things together: dietary management, water management, regular exercises, classes, psychotherapy as well, even the yoga and meditation classes. We take care of each and everything. And we tell you how to get out of all these stress. Right? So you can consult us for that reason also. Get enough sleep, that is also very much important. As I said earlier, not getting enough or sufficient quality of sleep may have serious impacts on our gut health. Lack of sleep consistency can affect gut health by lack of sleep can increase the stress, which affects the gut. Lack of sleep can affect dietary choices, hormones that control our hunger, when our sleep deprived, leading to an increased appetite. When we are tired, it's more likely that we will turn to unhealthy food choices for quick energy boost. For example, processed carbs, sugar, and trans fats. These foods are negatively impact our gut health. Lack of sleep hormones, melatonin, may be related to GERD. Melatonin is a hormone that our bodies make more of in the nighttime as it helps us fall asleep. But melatonin also helps regulate gastrointestinal mobility. When melatonin levels are thrown off, it can be difficult to sleep and it could potentially lead to GERD or gastroesophageal reflux disease. So eat too close to bedtime, which can negatively impact our digestive health. That's why what we say always, 2 to 3 hours before go to bed, you should complete your meal. Eat slowly is very much important to digest proper food. When we eat too fast, we swallow more air, which can cause bloating and gas. One of more important reason. Slowing down to properly chew our food helps to break down larger particles of food into smaller ones, aiding digestion. बचपन में सुना था ना, मुंह बंद करके चुपचाप धीरे धीरे खाना खाओ, मम्मी लोग हमें बहुत बोलते थे, है ना। तो वही चीज हमें बड़े होकर भी याद रखनी है कि मुंह बंद करके खाना खाएं, जिससे कि हम ज्यादा एयर को स्वेलो ना करें। तो पेट में जब हवा कम भरेगी तो फूड का डाइजेशन बढ़ेगा, इंप्रूव होगा, राइट। सो बेनिफिट्स क्या है स्लो ईटिंग का? बेटर डाइजेशन, इंप्रूव सैटिस्फैक्शन एंड एपेटाइट कंट्रोल, एनहांस एंजॉयमेंट ऑफ फूड, better weight management, improve nutrient absorption, and mindful eating habits. Stay hydrated. This is very important also. We always keep on saying itna pani pijiye, pani pijiye, pani pijiye. So what is required for digestion? What is very much important? Acting as a lubricant that facilitates the movement of food along the digestive tract. In the stomach, water combines with stomach acids to help break down proteins and aids in the digestive process. Water also softens the stool, preventing constipation and promoting regular bowel movements. Adequate hydration is part of the ideal environment for the growth of a healthy gut microbiome. And the amount of water drink may also contribute to the diversity and variation in the gut microbiome. So water is very much important. How to maintain your hydration and gut health? Plenty of water, eat hydrating foods, limit dehydrating beverages, and monitor your urine color also. It is natural urine color is pale yellow. If it is very like a water, then you are taking much of water, and so reduce your water intake. If it is more yellower side or more than pale yellow, then you are taking less of water. Just give a check on your urine color. Superfood for gut health. What are those? Balanced diet is one of the very important ways to keep the digestive system healthy. Here is the answer of Tanvi. High fiber food. Dietary fiber is the edible part of plants or analogous carbohydrates that are resistant to digestion and absorption by the human intestine. Dietary fiber includes polysaccharides, oligosaccharides, lignin, and associated plant substances. The recommended daily intake of dietary fiber varies between 25 to 35 gram per day. Prebiotic and probiotic are very much important. Probiotics originate from the Greek word probios, which means for life. So according to FAO and WHO, probiotics as live microorganisms that when administered in adequate amounts confer a health benefit on the host. These microorganisms, which consist mainly of bacteria but also include yeast, they are naturally present in fermented foods. Probiotics are beneficial bacteria which have been used for centuries in our Indian culture through fermentation. Prebiotics, which are typically complex carbohydrates such as inulin and other fructo oligosaccharides that microorganism in the GI tract use as metabolic fuel, which means prebiotics serve as food for probiotics, helping to improve the balance of microorganisms. Probiotics are in foods such as yogurt, sauerkraut. Prebiotics are in foods such as whole grains, bananas, greens, onions, garlic, soybeans, and artichoke. In addition, probiotics and prebiotics are added to some food and available as dietary supplements. Here, one picture is there where probiotics and prebiotics are there. Like you can see, paneer, desi curd, idli, buttermilk, dosa, green peas, soya milk, and pickles, as well as the dokla, rich in probiotics, and onions, oats, garlic, and our gut, banana, as well as the asparagus is having the prebiotics naturally in their place. Omega-3 fatty acid is very much important in many ways for different organs as well as for the digestive organ also. This is this acid is a type of polyunsaturated fat that are essential for the body's proper functioning. Omega-3 fatty acids has anti-inflammatory properties that may reduce or prevent inflammation and help with digestion. Omega-3 PUFA affect the gut microbiome in three main ways: modulating the type and abundance of gut microbes, altering the level of pro-inflammatory mediators such as endotoxins and IL-17, and regulating the level of short-chain fatty acids or MUFA. Omega-3s are found naturally in some foods and are added to some fortified foods. We can get adequate amounts of omega-3s by eating a variety of foods, including the following: fish and other seafoods, especially cold water fatty fish such as salmon, mackerel, tuna, herring, and sardines; nuts and seeds such as flax seeds, chia seeds, and walnuts; plant oils such as flaxseed, soybeans, and canola oil. Now, check our food intolerance. Many times we have seen food intolerance means our gut is sensitive to certain foods and can't tolerate them when we eat those foods. ऐसा कभी कभी हम लोगों के साथ भी होता है, बहुत ज्यादा नोजिया, माइग्रेन, हेडेक, डायरिया, एब्डोमिनल पेन, इस तरह की हमें चीजें जब फील होती है, इसका मतलब मे बी हमारी जो जीआई है उन फूड को टॉलरेट नहीं कर पा रही है, या हमारा इम्यून सिस्टम उन चीजों को टॉलरेट नहीं कर पा रहा है. द सिम्टम ऑफ फूड इंटॉलरेंस कैन take a while to emerge. The onset may occur several hours after ingesting a food, and the symptoms may persist for several hours or days. ऐसा कोई जरूरी नहीं है हमने कोई फूड लिया और इमीडिएटली हमें उसका इम्पैक्ट दिखाई देने लग जाता है. Commonly associated food, those are intolerance include the milk, gluten, food coloring and preservatives, sulfites, and other compounds such as caffeine and fructose. So, how you can identify? You need to understand, manage your food intolerance by आइडेंटिफाइंग योर ट्रिगर्स. अगर आपको कभी किसी फूड से ट्रिगर हो रहा है, जैसा अभी हमने बताया, तो आप उस चीज को लिख लीजिए अपने डायरी में या किसी कॉपी में या कैलेंडर में. फिर दोबारा कुछ दिन बाद वापस उसी चीज को खाइए. अगर सेम सिम्टम परसिस्ट होता है कि लाइक किसी को इचिंग हुआ है ना, या रेडनेस आया, तो सेम सिम्टम अगर एक हफ्ते बाद खाने के बाद भी वही होता है, मीन्स यू आर एलर्जिक टू दैट थिंग. अगर नेक्स्ट टाइम ऐसा कुछ नहीं होता है, इसका मतलब यू मे नॉट बी intolerant for that, right? So you can tolerate that. कुछ जो ट्रिगर कर रहे हैं फूड आपको बार बार, उनको you can avoid them. You can substitute those triggered food with that. Another thing, and कोशिश करिए कि प्रोसेस्ड फूड ना लेकर के आप घर में बना हुआ खाना ही खाइए, जिससे फूड इंटॉलरेंस को आप मैनेज कर पाए. उसके बाद आपको क्या करना है, दैट आई वाज टेलिंग यू अर्लियर आल्सो कि लाइक वी हैव टू चेंज अवर लाइफस्टाइल टू मैनेज अवर गट हेल्थ. व्हाट वी नीड टू डू: exercise regularly, eat a balanced diet, avoid smoking and excessive alcohol, limit artificial sweeteners and processed foods, make healthy fats prioritize, avoid overeating, avoid taking antibiotics unnecessarily, get regular bowel movements, get adequate sleep, practice yoga, meditation or any relaxing activities. As we all know, कभी कभी होता है ना कि थोड़ा सा इन्फेक्शन हो गया, हम फटाक से एक एंटीबायोटिक उठा के खा लिया। हमने उसका पूरा 3 दिन का कोर्स अगर डॉक्टर ने बताया है या 5 दिन का कोर्स बताया है, कई बार हम मिस कर जाते हैं। हम 2 दिन या 1 दिन दवाई खाने के बाद अगर ठीक हो जाते हैं तो हम उस एंटीबायोटिक को बंद कर देते हैं। तो हमारी बॉडी में क्या होता है, उसकी रेजिस्टेंस डेवलप भी हो जाती है, प्लस समटाइम्स इट मे क्रिएट अ प्रॉब्लम ऑल्सो। So how we can keep our gut healthy? We can do it with a 20 days challenge. What we can do? पहले हफ्ते में हम क्या करेंगे? हम सबसे पहले तो 2 लीटर तक पानी पिएंगे, है ना? उसके बाद हम ब्रीदिंग एंड माइंडफुल एक्सरसाइज करना शुरू करें। हम एक एक हफ्ते के टारगेट्स लेके चलें। शुगर लेवल को हम कट डाउन कर लें। प्रोबायोटिक फूड को हम लेना शुरू कर दें। पहले हफ्ते में हमने ये 2-3 चीजें की। फिर दूसरे हफ्ते में हमने क्या किया? हमने थोड़ा अपना चाय कॉफी को कम किया, कैफीन वाले प्रोडक्ट्स को कम किया, हमने ज्यादा वेजिटेबल्स हमने ऐड ऑन करी, हमने लीफी ग्रीन वेजिटेबल्स को ज्यादा खाना शुरू किया, हर्बल टी को इनकॉर्पोरेट किया, नॉर्मल टी को थोड़ा कम किया। वीक 3 में हमने क्या किया? हमने थोड़ा धीरे धीरे एक्सरसाइजेस को अपना बढ़ाया। हमने कट डाउन किया अपने कंजप्शन ऑफ मीट को, है ना? व्हाइट मीट हम लोग इनकॉर्पोरेट कर सकते हैं, रेड मीट को हम अवॉइड करेंगे, और प्रीबायोटिक रिच फूड को खाने का पूरा कोशिश। 4th वीक में फिर हमने क्या किया? फर्मेंटेड फूड्स को एड ऑन करना है। हमने जो स्टिक अपना बैलेंस डाइट हमने बनाया रिजीम, उसको पर हमने स्ट्रिक्टली उसको फॉलो करना है, उसको बनाना है, और जो हमारा डेयरी प्रोडक्ट का अमाउंट है उसको थोड़ा सा हमको रिड्यूस करना है। ये सारी चीजों को अगर हम प्रॉपरली करते हैं तो डेफिनेटली वी कैन change our lifestyle and we can make our gut very much healthy, right? So I think I have completed more of the things. Any questions, anything you would like to ask? Yeah, you are free to talk to me. You can ask any questions, any one of you.